Patient privacy is important for many reasons. First of all, it's law. Another reason is trust. A patient who trusts in the clinic or primary care physician tends to be more forthcoming about pertinent information, which leads to better care. Privacy also shields the patient from any embarrassment or stigma. Like in Beth's situation, maybe the professor was not ready to share his diagnosis and he wasn't ready to be felt sorry for. The difference between privacy and confidentiality. Privacy is about what the patient chooses to share willingly, and confidentiality is about what a doctor or nurse keeps safe after private information has been shared by the patient. When comparing and contrasting the two scenarios, the patterns and the major difference that I saw was that in the first scenario, it was purposeful and deliberate. She deliberately, and I understand she felt bad, but she deliberately shared the professor's information with friends. And although it came from a good place, it was still wrong and it wasn't her information to share. In the second scenario, it was accidental and carelessness. However, how accidental can it be when it's drilled into us that leaving a work desk in a shared environment is not safe for the patient's information? Violations that occurred: privacy, confidentiality, and security was in Beth's scenario. It was up to the professor to decide to share his diagnosis, not Beth's. Confidentiality, it was up to Beth to keep that information safe because he trusted her. Security, by accessing the home address and sharing it to others, that was a violation of the security on her part. On the other scenario, she left the file open in a shared workspace. This allows prying eyes to look where they please. And also, a breach was allowed because another patient had seen the patient's information, and then a secondary breach occurred when that patient shared it with other people in the waiting room. How should the individual conducting the violation should have reacted instead? In Beth's situation, she should have maintained professional boundaries, avoided sharing personal information, and if anything, she should have sought out guidance and she should have asked a supervisor about appropriate ways to reach out if there is an appropriate way. Scenario 2, she should have locked the screen or closed the file. Definitely follow protocols. And once a breach had been made, she needed to report it immediately to minimize the impact. As far as the federal laws,